Today was the first day of the National Insurance Board's registration drive for national health insurance. Good evening, everyone. I'm Charisma Robinson.
I'm Keishla Adderley. Thanks so much for joining us. Well, the new NIB Smart Card is the instrument being used to register for N.H.I, and 6 centers here in the capital have already been activated. Officials tell us operations on day one were slow as residents trickled in to the designated centers for processing.
While acknowledging the criticism of the plan, Labor Minister Shane Gibson told our N.H.I Ferguson that he anticipates Bahamians and other stakeholders will identify the benefits of national health insurance and buy in.
Registration centers open throughout the country today for legal residents to sign up for their new NIB Smart Card, the tool being used to register Bahamians for national health insurance. But senior consultants and physicians have reportedly decided not to support N.H.I. Minister with responsibility for NIB, Shane Gibson, said those in the medical industry opposing the plan are simply watching their bottom line.
If they think that making the mighty dollar is more important than saving lives, I can't kill them for that. Everybody's entitled to their opinion. If you have, for instance, 1,000 doctors and 50 of them say we're not going to support it, is that buy-in that you need? I'm saying is we have medical doctors on staff at all of our healthcare facilities. We have medical facilities and healthcare providers who said to us publicly and privately they support it.
There have also been reports from stakeholders who claim that information on N.H.I has not been forthcoming from the government.
I've been in meetings with stakeholders who I saw in the paper subsequent to that who said that they had no meetings with us. And so no meetings and no consultation in my mind to them means if I can't have it my way, then I'm going to tell the public I'm not a part of the process. If anybody knows Prime Minister Perry Gladstone Christie, he is huge on consultation, huge on it. And he made it clear that nothing will happen unless you have widespread consultation with all of the stakeholders.
And while insurance companies are also not agreeing to N.H.I, Minister Gibson confirmed that the government intends to prepare to compete with them only if there is not sufficient support.
And what we will not allow anybody to do is hold us hostage. And so if you have healthcare providers who are telling you now we're not going to participate, why should we not prepare for it? They're telling you we're not going to participate. And we must just roll back and decide that we're not going to prepare. And so if all of the providers give access to everybody as we anticipate, then we would have less of a role to play.
Turnout was slow at registration centers today, but Bahamians who are registering say they support the initiative.
Here, national health is really, we need it. We do need it.
What I'm looking at too is seeing that it's going to benefit a lot of Bahamians in terms of who can afford private health coverage. So I support it because I want to benefit from it also.
The next phase of the plan includes access to primary care. Gibson says catastrophic cases will also be included.
Do you think the government will just say, oh, you have colon cancer, we're providing health care, you could go home? No. The idea is to create a special fund where we are able to assist those individuals when you identify illnesses beyond what primary health care would provide for.
Now, only about 150,000 persons have received their new NIB cards, which will automatically register them for the government's National Health Insurance Scheme. Officials say they're targeting some 207,000 persons, hopefully to have them registered by April of this year. N.H.I Ferguson, ZNS Network News.
Well, the next phase of the National Health Insurance Plan is the primary health care phase, which includes doctor visits, prevention services, diagnostics, and medication through a primary care provider, all at no cost for legal residents and no new taxes being imposed in the initial phase. The N.H.I Secretariat confirmed in a statement that government will pay for all primary service health costs through general revenue collected by the Ministry of Finance or the Consolidated Fund. Full benefits, including catastrophic care for major illnesses, will be included as the program progresses. Those who currently have private health insurance can maintain their current policies if they choose. However, it's possible that your policy may change given that primary care will be covered by government. Additional health insurance could be topped up to your N.H.I coverage. Enhanced capacity in the health sector will also be realized because N.H.I beneficiaries will be allowed to choose providers, that is, from the public or private sector.